Well, thank you very much, Tanya. And it's fantastic to be back in Western Australia for my 30th visit as Prime Minister. I committed in 2022 to come here 10 times a year. I've met that KPI and I'll exceed it because chances are, to the Premier, I'll be back over the next over the coming weeks, absolutely. And it's great to be here with Tanya Lawrence, the local member, and Trish Cook, our candidate for the new seat of Bullwinkle. Bullwinkle, of course, named after one of Australia's most famous nurses, and we're running a nurse and midwife. Nothing says Western Australia more than a nurse who worked in the offshore resources sector, and that is Trish Cook. She will be an amazing Member of Parliament here, joining the fantastic team that I have from Western Australia that, of course, was added to in 2022. Now, this is a choice, this election. It's a choice between Labor building Australia's future and strengthening Medicare and a coalition led by Peter Dutton that wants to cut everything except for your taxes. A coalition that will cut Medicare as sure as night follows day because they've got to find $600 billion for their nuclear fantasy, including a nuclear power plant down there at Collie. He hasn't actually bothered to visit that site up close. If he did, he'd see what is the real future of energy in WA, which is renewables backed by gas, backed by firming capacity, including batteries, that are being built there on site to connect up with the transmission lines that are currently used by the Collie coal-fired power plant, which will close this decade and which will be replaced by what is WA's future energy needs, led by the Premier, Roger Cook. We will invest $200 million to renovate and extend St John of God Midland Public Hospital to deliver more beds and a new emergency department. Only Labor is strengthening Medicare. The largest investment that we have seen in 40 years is our tripling of the bulk billing incentive. So whether it be our funding for public hospitals, our health and hospitals agreement delivered $1.7 billion extra this year, an agreement that we signed up with states and territories earlier this year. You have then the tripling of the bulk billing incentive, $8.5 billion to make sure that people can see a GP for free, and of course our 50 new Medicare urgent care clinics. These urgent care clinics are making such a difference. We have 8 already in Western Australia. We will build and fund another 6 that will make a substantial difference. They've been seen by about 1.3 million Australians already. And these measures, of course, added to by our cut to the cost of medicines down to just $25, the same price that they were back in 2004. We believe that Medicare is absolutely critical and that Australians should just need their Medicare card to get the health care they need rather than their credit card. And it's a big distinction between the government and the opposition at this election campaign. This is joint investment. It follows the announcement that the Cook government gave during their campaign that they are adding to. And it's an example of the partnership I have with my friend Roger Cook. We've known each other for 40 years. Sorry to give up our age here of both of us. We've been friends for all of that time. And it is an absolute privilege to be in a position of a bloke that we used to have a beer with 40 years ago and chat about footy and chat about life, to actually be in a position to make a difference for Western Australians. I regard Western Australia not as an add-on, not as an afterthought. It's something that's front and centre and has been front and centre since I've been in public life. I first came here in 1983, 84. I had Christmas Day here in 1983 over at Rottnest Island. As a very young man, Latika, I was very young at that time, and I spent a couple of months here, and I came to love this great state and its people. Ever since then, I've returned as a public office holder to make a difference. This joint investment will deliver 60 new medical and surgical beds. It will deliver 6 critical care or intensive care unit beds, taking the ICU here from 12 to 18 beds, more same-day beds, 2 new operating theatres, a redesign of obstetrics and the neonatal unit. It was a great pleasure today to have a cuddle with young Amber, just 27 hours old. And I do want to pay tribute to all the doctors, nurses and health professionals here. You do such an extraordinary job. It's an incredibly difficult but an honourable job that you do, looking after our fellow Australians. We want, and I want to lead a government that is committed and as determined to deliver healthcare for Australians that they deserve, as strong as your personal commitment. I'll turn now to the Minister, and then we will happy to take some questions. Premier. Yeah. Premier.
Thank you very much, Prime Minister. It's great to be here at Midland Hospital once again with Trish and Tanya. Also, I'd like to acknowledge Minister Mark Butler and our new member for Midland, Steve Catania, who's joined us as well. I'd like to thank Kerry Sanderson, the chair of the board chair of St John of God, and Royce and their team for having us here at the Midland Hospital. And my vision for WA is for Western Australia to be the healthiest state in the nation. And not only do we have the strongest economy and the fastest growing economy, we have the fastest growing population in the nation as well. And that's why we're working to support and invest in WA's world-class hospitals. Our government's joint commitment today of $355 million to expand the Midland Health Campus is an important next step to ensure that the people in these northeastern suburbs get the healthcare they need when they need it. Combined with the urgent care clinic expansion that's gone on out here, you can see how we're really setting up people in the northeastern suburbs to continued access to quality world-class healthcare. The $200 million investment from the Albanese government comes on top of our $105 million investment, our commitment by my government for upgrades here at the Midland Health Campus ED. And today I can reveal that my government will contribute a further $50 million as part of the upgrades that we're announcing this morning, part of the great partnership between the Albanese Labor government and the Cook Labor government. The expansion will add 60 more inpatient beds, 2 more operating theatres, a new ICU and as well as the new emergency department. And this will slash waiting times, tackle ambulance ramping and upgrade the facilities for patients and staff. We will also increase the size of the ICU by 50%, which means that we can care for more chronically ill patients, but also undertake more higher risk operations as well. This investment in collaboration with the Albanese government is yet another example of our commitment to reduce pressure on Western Australia's health system, and we're building the infrastructure we need to reduce wait times and tackle ambulance ramping. My government has invested an unprecedented $14.3 billion in new funding for our healthcare system since 2021. We've added more than 700 beds, the equivalent of a large tertiary hospital. And we continue to invest to make sure we have the expansion in hospitals here like St John of God Midland. It's another way that we're delivering projects and making sure that people have access to world-class health care, and we can make a difference to the experience of patients coming to this hospital. But we know there's always more to be done, and that's why my government has worked hard to increase WA's health workforce by more than 30%. Great nurses and doctors coming to work in our hospitals. And we've stabilised the health system. We're now doing more elective surgery than ever before, reducing elective surgery wait time. And today's announcement is about taking real action to continue to make sure that our healthcare system is setting Western Australia up for the future. And now I hand you over to Mark Butler.
Thank you, Premier. Thank you, Prime Minister. It's so good to be here at the Midland Public Hospital. I want to thank St John of God for the work that you do delivering the services here. You've been delivering hospital services here in Western Australia since the late 1800s. You are really an institution in this great state of our federation. It's great to be here with my colleague Tanya, but also with Trish Cook. I met Trish about 12 months ago at an International Melanoma Institute conference where she was presenting her findings in her PhD study as a nurse and midwife about the benefits of delivering chemotherapy and immunotherapy to patients in the home. It would be just terrific to have another nurse in our caucus. We already have one, Jed Carney, who adds an enormous amount to the health discussions in our government, and we're so excited at the prospect of Trish coming and joining us and bringing her long experience as a nurse and midwife and her determination to expand her understanding of good modern health policy and health delivery as well. When I was a very young Assistant Minister for Health, I remember Kevin Rudd announcing a $180 million commitment to build this hospital. We shared the funding to build the hospital back when $360 million bought a little bit more than it does today, perhaps, Roger. But we built this hospital together, the Commonwealth and Western Australian Government, and I'm so delighted that we're here today to say that together we will extend this hospital to meet the growing needs of the northeastern suburbs of Perth and right into the wheat belt as well. The Prime Minister and the Premier have already expanded on what this is going to deliver to this fast-growing community, and it's a really exciting announcement that we're able to make together. But I also want to say to those hard-working doctors and nurses and health professionals and orderlies and cleaners and everyone else working at this hospital that this government has your back. That is why we delivered every single one of you a tax cut last year, something that Peter Dutton opposed at the time when we wanted to deliver working people a bigger tax cut rather than people at the higher income levels, making sure that every single taxpayer got a tax cut, not just some of them. It's also why we legislated top-up tax cuts over the next 2 years for every single taxpayer again, something that Peter Dutton has promised to repeal and take away from every worker in this hospital. But it's also why we delivered $60 million in funding to the Western Australian Government last year to help smooth the path of older patients in hospitals. We know this is a challenge for every single of the 700 public hospitals across Australia, and we're determined to work with state governments like Rogers to help smooth that path. It's also why we've opened 8 Medicare urgent care clinics here, including here in Midland, which has already seen more than 15,000 patients, every single one of whom was bulk billed, and most of whom would otherwise have ended up in the emergency department here at the public hospital. And that's why we've promised 6 more, including one at Ellenbrook in this catchment and one out at Mundaring, where Trish is a local councillor as well. But it's also, really importantly, why we have promised and will deliver an 11% increase in hospital funding to Western Australia next year, in 25-26. That's an additional $370 million from the Commonwealth, the biggest increase in many, many, many years, to help Roger make sure that the hard-working doctors and nurses and health professionals at this and every other public hospital in Western Australia is able to deal with the growing pressure that every hospital system is confronting, the legacy of COVID, a growing older population with more chronic disease. So this is that reliable, constructive partnership that the Prime Minister and the Premier talked about so much. And it couldn't be more different than the record of Peter Dutton. When he came to government as the Health Minister, he tried to cut $50 billion from public hospitals. Not do the sorts of things I've just outlined. That would have cut more than $6 billion from Western Australia's public hospitals, making it just so much harder for all of the doctors and nurses and staff working at this public hospital and every other one across the state to do their job. I mean, he said 2 weeks ago, judge his future actions on his past performance. Well, that was his past performance. There's the clearest possible choice at this election between a Prime Minister who will cut your taxes or Peter Dutton who will cut Medicare.
Just here.
I'll start with a reader question, if I may.
Sure.
This one's from Nathan from Griffin in Queensland.
Nathan, my favourite name.
Considering Dutton has announced $400 million for youth mental health, what are you doing to help people access mental health services and make it more affordable?
Thanks. I'll ask Mark to add to this, but one of the things that we've done on top of Medicare urgent care clinics is to have Medicare mental health centres. Now, we've funded these. These are making an enormous difference, and that comes on top of the specific programs we have for youth mental health as well through the centres, one of which is in my electorate in Ashfield, that has made a substantial difference.
Thank you, Prime Minister. Well, we've done a range of things really in mental health. We know there's a very significant pressure in the community around this. The most important thing we do, first of all, is to expand bulk billing access to GPs. GPs do more mental health work than any other part of the health workforce, and the investments we've made in bulk billing cover mental health items for GPs to be able to do that work as well. We've also expanded Headspace. Only a very short time ago, we announced a range of expansions to Headspace, including modernising the model of care there, working with a whole bunch of people who set that model up after all. These Medicare mental health centres that the Prime Minister talked about, they're bulk billed. Importantly, they're bulk billed, available on a walk-in basis, just like urgent care clinics. We'll open 61. We've already opened, I've lost count, we're opening them every week almost at the moment, over 35 of them. And on the 1st of January, we will open for the first time an early intervention service available to every Australian without a doctor's referral, on the phone or on digital. This is something that operates in the UK and most other countries to which we compare ourselves, and it will provide much better, free of charge access to mental health services early when people need it.